Ever wondered what causes that painful sore throat and difficulty swallowing? Today, we delve into the world of tonsillitis. Tonsillitis, quite simply, is inflammation of the tonsils. These almond-shaped patches of tissue sit at the back of your throat, acting as your body's first line of defense against bacterial and viral invaders. However, sometimes these invaders manage to infiltrate the tonsils themselves, leading to an infection. This infection is what we commonly refer to as tonsillitis. While it can affect people of all ages, it's especially prevalent among children. Symptoms can range from a simple sore throat to more severe difficulties swallowing. If left untreated, tonsillitis can lead to complications, making it more than just a common throat irritation. But fear not, with good hygiene practices, the spread of this infection can be prevented, protecting you and your loved ones. So, buckle up as we unravel the mysteries of tonsillitis. Before we get to tonsillitis, it's vital to understand what tonsils are. Tonsils are small, fleshy, almond-shaped tissues that we have two of, located at the back of our throat. They're part of our body's lymphatic system, which is responsible for fighting infections. As part of this system, our tonsils serve as frontline defense mechanisms against airborne pathogens. They do this by trapping germs that we breathe in, and with the help of white blood cells, they also help our body recognize and fight off these germs. Despite their small size, tonsils play a significant role in our immune system, especially during early childhood. They work tirelessly to protect us from various infections, acting as a biological filter, blocking harmful bacteria and viruses from entering our body through the mouth and nose. So, the next time you gulp down a glass of water or take a deep breath, remember, your tonsils are working round the clock to keep you healthy. Now that we know what tonsils are and their role, let's move on to what happens when they become inflamed. So, what causes these warriors of our immune system to become inflamed? Tonsillitis, as we know, is primarily caused by two types of infections, bacterial and viral. These infections occur when harmful microorganisms, which are normally kept at bay by our immune system, manage to infiltrate and colonize the tonsils. Starting with bacterial infections, the most common culprit is a type of bacteria known as Group A Streptococcus. You might be familiar with this bacterium since it's the same one that causes strep throat. It's a crafty little invader, capable of surviving in our throat and nose, waiting for the right moment to strike when our immune defenses are down. On the other hand, viral infections account for a significant amount of tonsillitis cases as well. The usual suspects here include the Epstein-Barr virus, which is notorious for causing mononucleosis, also known as mono or the kissing disease. Other viruses such as the influenza virus, adenoviruses, and the common cold virus, rhinovirus, can also inflame the tonsils. While these infections are common in everyone, children tend to get tonsillitis more often. This is partly because their immune systems are still developing and are therefore more susceptible to infections. Furthermore, children are more likely to come into close contact with others at school or during play, which increases their chances of catching an infection. So, how do these infections get transmitted? Well, both bacterial and viral infections can easily spread from person to person through droplets in the air, especially when someone with an infection coughs or sneezes. They can also spread by touching a surface where these droplets have landed and then touching your mouth or nose. In essence, tonsillitis is a battlefield in our throats, where our body fights off invaders. Now, how does one know if they have tonsillitis? What signs should they look out for? Well, the symptoms of tonsillitis can vary widely, but there are some hallmark signs that can help you identify if you or someone else may be dealing with this condition. The most common symptoms are related to your throat and oral health, given the location of the tonsils. One of the first things you might notice is a sore throat. This isn't just your run-of-the-mill scratchy throat that you might get from allergies or a little post-nasal drip. We're talking about a persistent, often severe soreness that can make it difficult to swallow. Speaking of swallowing, difficulty with this action is another common symptom of tonsillitis. This can range from a mild discomfort to an intense pain that makes eating or drinking a challenge. The pain can be so bad that even talking becomes a task. Now, if you take a peek in the mirror and open wide, you might see that your tonsils are larger than usual. Swollen tonsils are a clear sign that something's up, especially if they're red and inflamed or if there are white or yellow patches on them. Beyond these throat-specific symptoms, there are other signs that you might be dealing with tonsillitis. You may have a fever, indicating that your body is fighting off an infection. Some people also experience headaches or feel tired and run down. And let's not forget about bad breath. Yes, tonsillitis can cause your breath to take on a less than pleasant aroma, thanks to the bacteria or virus causing the infection. So, to recap, if you're experiencing a persistent sore throat, difficulty swallowing, swollen tonsils, and possibly a fever, headache, fatigue, or bad breath, then you might have tonsillitis. Recognizing these symptoms early can aid in a quick diagnosis and treatment. So, you suspect you have tonsillitis. What next? There are several treatment options available for tonsillitis, and the choice largely depends on the cause and severity of the infection. If your tonsillitis is caused by a bacterial infection, which is often the case with streptococcal bacteria, your doctor might prescribe antibiotics. Antibiotics can help reduce the duration of symptoms and prevent complications, but remember, it's crucial to complete the full course of medication, even if you start feeling better before it's over. However, if a virus is the culprit, antibiotics won't be effective. In such cases, the body typically fights off the infection on its own within about a week. During this time, it's important to rest and stay hydrated. Hydration not only keeps your throat moist, which can ease the soreness, but also helps your body fight off the infection more effectively. Over-the-counter pain relievers can also be a lifesaver when dealing with tonsillitis. They can help reduce fever and alleviate pain. It's also recommended to use a humidifier and gargle with warm salt water to soothe a sore throat. Now, in severe or recurrent cases of tonsillitis, your doctor might recommend a tonsillectomy, which is the surgical removal of the tonsils. This isn't a decision taken lightly, as any surgery carries risks. It's usually considered when tonsillitis is causing major disruptions to daily life, like missing a lot of school or work, or when it leads to serious complications, such as abscesses that don't respond to other treatments. But remember, the best treatment is always prevention, so good hygiene practices are essential. Washing your hands frequently, avoiding close contact with people who are sick, and not sharing personal items like toothbrushes or eating utensils can go a long way in preventing the spread of the germs that cause tonsillitis. So, if you suspect you have tonsillitis, don't panic. There are several treatment options available. Consult with your healthcare provider to determine the best course of action for you. Let's recap what we've learned about tonsillitis. This common condition is an inflammation of the tonsils, those two oval-shaped pads of tissue at the back of your throat. While it's most frequently seen in children, it can affect people of all ages, leaving them with a sore throat, difficulty swallowing, and swollen tonsils. The causes of tonsillitis are primarily viral or bacterial infections. Viruses like the common cold or influenza can lead to tonsillitis, but so can bacteria. Most commonly, Streptococcus pyogenes, the culprit behind strep throat. It's important to note that tonsillitis is contagious, spreading through droplets in the air from coughing or sneezing. Good hygiene practices, like washing your hands frequently, can help prevent the spread of these infections. As for symptoms, they range from a sore throat and difficulty swallowing to fever, ear pain, and a scratchy or muffled voice. Don't forget the visible swelling of the tonsils, often with white or yellow patches. It's these symptoms that usually send people to the doctor's office, seeking relief. Speaking of relief, let's touch on treatment again. Depending on the cause, treatments can vary from rest and hydration to antibiotics for bacterial infections. It's crucial to complete any prescribed antibiotic course to fully eliminate the bacteria and prevent complications. For severe or recurrent cases, a tonsillectomy or surgical removal of the tonsils may be recommended. With this knowledge, you're now better equipped to deal with tonsillitis, whether it's for yourself, a loved one, or a patient. Until next time, stay healthy and keep learning.